$3,400. Gone, not from a medical emergency, not from a diagnosis, from a billing error on a Medicare statement that Barbara almost paid without questioning. She had the check written, envelope sealed, and then her daughter said 4 words that changed everything. Did you check this? If you are on Medicare right now, that same mistake may already be in your mailbox. Barbara is a retired accountant from outside of Denver, Colorado. 31 years working with numbers. She reviewed financial documents for a living, and she still almost paid $3,400 she did not owe. Not because she was careless, because Medicare billing uses a coding system so complex that even providers make mistakes regularly, and most seniors have no idea what to look for. This is what most people do not realize. Medicare billing errors are not rare. The Government Accountability Office has documented that improper Medicare payments, driven largely by billing errors and incorrect coding, run into the tens of billions of dollars annually. Some of that is fraud, but a significant portion is simply mistakes. Providers billing incorrectly, codes entered wrong, duplicate charges that slip through processing undetected. And because most patients never review their explanation of benefits carefully, those errors get paid. By you. Out of your retirement savings, every time you receive medical care under Medicare, your provider sends a claim to Medicare. Medicare processes that claim and sends you a document called the Explanation of Benefits, or EOB. This document shows what was billed, what Medicare paid, what your plan paid, and what you allegedly owe. Most seniors glance at it, assume the numbers are correct, and set it aside. Some never open it at all. That assumption is costing people thousands of dollars every year, and this is where it gets expensive. Barbara received her EOB after a routine hospitalization. The bill listed several line items she did not recognize. One was a procedure code for a service she was almost certain she never received. Another showed a charge for a specialist consultation on a day she had already been discharged, a day she was not even in the building. She almost paid it anyway. Her check was already written. Then her daughter asked 4 words. Barbara put the check down and made one phone call instead. The mistake was on the provider's side. A billing department had applied codes from a different patient's file to hers. It happens more often than hospitals will ever admit. Medicare corrected it once Barbara flagged it. But she had to flag it. Nobody was going to do it for her. So what do you actually do when your EOB arrives? First, open it. Every single one. The explanation of benefits is not junk mail. It is a financial document that directly affects your money and your retirement. Second, match it against your own records. Keep a simple log of every medical appointment, every procedure, every prescription filled. When your EOB arrives, compare it line by line against that log. Does the date match your actual appointment? Does the service description match what happened? Is the provider name someone you actually saw? Barbara had no idea any of this existed when she almost mailed that check. She had never been told to review her EOB line by line. She assumed Medicare handled accuracy automatically. It does not. Third, look for duplicate charges. Same date, same code, charged twice. Medicare may catch it, or it may not. Your review is your best protection. Fourth, look for services you never received. A procedure ordered but never performed. A consultation that was scheduled but canceled. A supply item that was never delivered. If it is on your bill and it did not happen, it should not be there. Call the provider and ask for an itemized bill, a complete breakdown of every charge by date and service code. You have the right to request this regardless of which plan you are on. But this is not even the worst part. The most expensive billing errors are not the obvious ones. They are the coding errors. Every medical service has a specific 5-digit billing code. When a provider uses the wrong code, even by 1 digit, Medicare may deny the claim entirely and leave the full cost to you. Or it may approve the service at a lower rate than it should, leaving you with a larger share than you legally owe. These errors are invisible unless you know what you are looking at. And most people never look. Here is what you do when you find an error. Contact the provider directly and ask for a corrected claim to be submitted to Medicare. Most billing errors are resolved at this stage. The provider resubmits with the correct codes and the charge disappears or is reduced. If the provider refuses to correct it, call Medicare directly at 1-800-MEDICARE and report the billing concern. Medicare has a process for investigating disputed claims and can intervene on your behalf. Document everything. Write down the date of every call, the name of every person you spoke to, and what they told you. And this is exactly where people lose money. Not in one dramatic moment, quietly, bill after bill, because they paid without questioning, and the system never told them they could push back. Now here is the part that gets harder. What happens when you dispute a charge and the insurance company refuses to correct it? If you are in original Medicare and the provider refuses to resubmit, you can file a formal appeal directly with Medicare. The appeal must be filed within 120 days of receiving your initial claim decision. You will need a written explanation of why you believe the charge is incorrect, along with any documentation, your own records, notes from appointments, anything that supports your case. Medicare will assign an independent reviewer to look at the dispute. That reviewer is separate from the original claims processor. Their decision carries weight. If you are on a Medicare Advantage plan, the appeal process goes through the private insurance company first. You have 60 days to file a written appeal after a claim decision. If the plan denies your appeal, you can request an independent review by an outside organization. That external review is binding on the plan, meaning if the reviewer rules in your favor, the plan must correct the charge regardless of their internal decision. Most seniors do not use these processes because they do not know they exist. The denial letter arrives and they assume it is final. It is not. And here is something that surprises people when they first hear it. You have up to 3 years to report certain Medicare billing errors in some circumstances. You are not automatically locked out because time has passed. If you have old explanation of benefits documents sitting in a drawer that you never reviewed carefully, it may be worth going back through them, particularly if you had a hospitalization, a surgery, or a prolonged course of treatment in the past year or two. There is also a document most seniors have never heard of that makes this entire process easier. It is called the Medicare Summary Notice. If you are enrolled in Original Medicare, Medicare mails you this document every 3 months. It is a complete summary of every claim processed under your name during that period, every provider, every service, every charge, compared side by side in one document. The reason this matters is that patterns of error are easier to spot across multiple months than in a single EOB. One unfamiliar charge might be easy to miss. 4 of them across 3 months, all from the same provider, all for services you do not recall. That is a pattern. That is something worth a phone call. Here is exactly what to look for when you open your Medicare Summary Notice. Start with the provider names. Does every name on that list match a doctor or facility you actually visited during that period? Then check the dates. If a service is listed on a date you were not seen, that is an error. Then look at the description column. Medicare uses plain English descriptions alongside the billing codes, things like office visit or lab work or imaging. If you see a description that does not match what happened at that appointment, flag it. You do not need to understand the 5-digit code. You just need to know whether the description matches your memory of the visit. If you have not been reading your Medicare Summary Notices, start now. They are available online through your My Medicare Gov account at any time. You do not have to wait for the paper version to arrive in the mail. If navigating this feels overwhelming, and it does feel overwhelming, even to a retired accountant from Denver, your State Health Insurance Assistance Program, SHIP, has counselors trained specifically to help you review Medicare bills, identify errors, and navigate the appeal process. It is completely free. Find your state's program at medicare.gov. Barbara got her $3,400 back. It took several weeks and a handful of phone calls, but she got it back because she asked one question before she mailed that check. You have that same question available to you right now. Pull out your most recent explanation of benefits. Look at the dates. Look at the service descriptions. If anything looks unfamiliar or wrong, do not pay it yet. Call the provider. Ask for the itemized bill. Start the conversation. If this video helped you see your Medicare statements differently, like it right now and subscribe to this channel. Every video here covers something the Medicare system never explains clearly, and the next one could save you just as much as this one. Leave a comment below. Have you ever found an error on a Medicare bill? Tell me what happened. I read every comment. The next video covers Medicare scams targeting seniors in 2026. More sophisticated than ever, using Medicare as the door to steal your identity and your money. If you or someone you love has ever received an unexpected call, text, or card about Medicare benefits, that video is not optional. It is coming up next.